So hi everybody, my name is Haralabos Katsoulas. I'm from the National Organization for Medicines from Greece, and I'm going to present the answers to deficiency 1 and 2. So the first deficiency was about equipment, and more specifically the freezer used to store tissues or cells at a minus 80 degrees Celsius was not validated for use. The majority of our group classified it as a major deficiency, while some of them said it was critical, because validation is a very important procedure in order to get a product of consistent quality. But on the other hand, there was a few members said that if we have a lot of control points which monitor the procedure, then it should be classified as a major deficiency. So on the second question, what do you consider to be the key components in the validation of temperature control devices or areas? We had a few points here. Temperature mapping, displacement through the chamber. Calibration is a key component of the validation. If a door has been left open the time it needs to lose its temperature, a backup system in place, and also maintain a schedule of equipment, and also empty load and full load mapping. And if there's a change of compressor, then there's need for a revalidation and change control. So as far as the appropriate company response, the company will submit a validation master plan in order to see if all systems are validated and reviewed, and also a risk assessment has to be performed. So moving on, deficiency 2. About donor testing, tissues and cells were released for use and or further processing, which had not been tested in accordance with the specifications and legislation requirements. This is considered as a critical deficiency from everybody in our group, because it's an imminent health risk for transmission of infectious disease, possible transmission, or microbiological contamination, and the quality and safety of the product cannot be ensured. So is there any action you would take immediately? Cease operation, recall the product, a look-back procedure should be initiated in order to provide a report, and risk assessment performed in order to answer what caused the problem, and also who is the responsible person. So as far as the appropriate company response to this deficiency, there should be a review in their procedures and protocols, and also in relevance with the legislative requirements, there should be a review in the training protocols, and but the recalls, there should be a notification to the authorities and a product recall report. So that's all, first two deficiencies. Thank you.
Thank you, Group 1. Kita ke Group 2.